it's not what you know, it's not who you know, it's who knows you. And this young gentleman, his name is Joris, and Charo from the Butterfly Children's Charity knows him and thought he would be a lovely guest for Marbella Now. So delighted to welcome you to the program.
Thank you very much. Thanks for the invitation.
It's nice to have Ceram once again on the program, and you specialise, Joris, in joints, but in like repairing hip joints and knee joints, which is actually quite a common ailment, more so than I had thought until I looked into it.
Yeah.
So you do a very worthy job.
A very worthy job. Yeah, I'm an orthopedic surgeon from the Netherlands, and I work since 1 year in Ceram with two colleagues, with Dr. Henkes and Fernando Hernandez, and a colleague from Venezuela. And we are specialized in hip and knee surgery. So hip replacement, knee replacement, and especially in hip replacement by the anterior approach. That means that you don't have to detach muscles to insert the hip joint.
I mean, when you hear someone's had broken a hip, and quite often as you get older, these things, obviously you're more susceptible to falling and your bones are frailer. Does it matter the age that one has an intervention, or with this new approach it's a little bit safer?
There's a difference between osteoporosis, the fragility of the bones, or osteoarthritis, that's damage of the cartilage. And what I do is repairing the damage of the cartilage. So I remove the head of the hip and place a new hip in it. If the bone is okay, it's strong enough, you can do it without cement, without bone cement. So there's some coating on the hip, and you can place it in the bone, and it will grow in. If there is osteoporosis combined with osteoarthritis, you have to use cement, bone cement, for a good fixation of the stem of the hip.
It's amazing, really. We talk about nowadays robotics and things, but there's an awful lot already being used in modern medicine that is very much about making us all fake bits to make us work better. How did you get involved in this?
Yeah, there's some new techniques in the bone specialties, but they are not so far as we wanted they are be. The problem is that bone, you can't repair bone. So we want to get some new inventions, and they are busy with it, but they're not far enough to get it in patients.
I mean, we're hearing talks about 3D printers being able to create these different parts that we need. How far away is that? How much of a reality is that?
No, we use specific instruments for better placement with 3D printing, but it's not good enough for daily use. It is in the research part of medicine. What
was your decision to come to practice in Marbella?
I work 4 days in The Hague in the Netherlands, and we have a second home here. So the weather it's good. It is nice to work in another hospital, and I like to combine both worlds.
Well, that is a very sensible young man. So you really are living the best of both worlds. You get to have financed holidays by coming up and doing operations in Marbella, because obviously it's a nice complement and a big Dutch community.
Yeah, it's a big Dutch community. There are a lot of German people, English people, other countries are involved here. But the main reason is that the combination of a big training hospital in Holland, where I work, combined with a private hospital in Marbella. And I like that combination.
It really is a lovely combination. Do your patients normally come just from locally, or do people actually come to Marbella to be able to have appointments at Ceram?
They come from all the Costa del Sol, but I also have patients from The Hague that are in the winter are here and want to have a consultation in Marbella. And a second opinion, or they have some questions about pain in their hip or their knees, and they come to Marbella.
Wonderful. So if someone actually has something happens to them, they can actually choose to say, I would like to go and see you stop everything. I want to go and speak to the team at Ceram, Joris's
Yeah.
team. Is that how it works? Because
Yeah,
normally
there's
when you fall over, you're rushed off somewhere.
Yeah.
So
Yeah, you can stop and come to Ceram, and I will arrange your problem.
and so you have all the installations and all
All
everything
the
that they-
installations. There's you can do the sterilization there. You can make X-rays. You can do everything there. Ultrasound, whatever you want.
There you go. So, if you want the latest technology, and I imagine the least amount of pain by doing the least invasive things that you can, no? It's the idea.
The problem in Spain is they use in most hospitals the old approach of the hip surgery. It's the approach from behind, and if you the posterior approach, and the rehab after that operation is 6 up to 12 weeks. But if you use the anterior approach, you can do it in daycare. You can come
That's a big difference.
in the morning, replace the hip joint, and go home in the afternoon.
So, I mean, that is a very major difference.
There's a major difference.
Speechless. Speechless.